Dear colleagues, I'm Christoph Diener from the Faculty of Medicine at the University of Duisburg-Essen in Germany, and today I would like to report interesting studies which were published in December 2022. I would like to start with familial cavernoma in the brain. There was an interesting observation a few years ago that cavernomas in the skin, angiocavernomas in the skin, respond to a treatment with propranolol. And therefore, a study was now done in people with familial cavernoma in the brain. In this pilot study, small pilot study, 57 patients either received propranolol or placebo, and they were followed for 2 years. And the rate of symptomatic intracerebral hemorrhage or focal neurological deficits was reduced by 50% in people who received propranolol. Now, this is a pilot study, and the results have to be replicated in a much larger phase 3 trial. The next study, published in Lancet, investigated the possible benefit of lowering increased blood pressure in stroke patients who undergo mechanical thrombectomy. This study was done in China and had 821 patients who had a systolic blood pressure above 140 millimeters mercury after mechanical thrombectomy, and they were randomized either to aggressive blood lowering therapy with a target of below 120 or in a corridor between 140 and 180 millimeters mercury. The primary endpoint was modified Rankin scale. The aggressive blood pressure lowering treatment was clearly inferior to control. And this is hopefully the last of many studies which investigated lowering increased blood pressure in ischemic stroke, because all of these studies were clearly negative or neutral. My next study, which was published in Lancet Neurology, deals with remote ischemic conditioning. A study in China in some of these years had shown that remote ischemic conditioning by ischemia of the arms improves the outcome of acute ischemic stroke. The second study now investigated this approach in people with symptomatic intracranial stenosis. The study recruited more than 3,000 patients, and half of them were subjected to 30 minutes of intermittent ischemia of the arms for 1 year and a control group. The primary outcome was fatal or non-fatal recurrent stroke, and there was no difference, and there was also no difference in mortality. So obviously, this approach does not work in secondary stroke prevention. My next study was published in JAMA Oncology, and this, I think, is a breakthrough study. This was the first study which investigated vaccination in people with newly diagnosed or recurrent glioblastoma. This vaccine is developed from lysis-loaded dendritic cells from the tumor. And the study recruited 232 patients who received the vaccine and 99 placebo. And the survival time was significantly prolonged after vaccination, but we need larger replication studies. My next study is in people with so-called radiologically isolated syndrome. These are patients who have no symptoms, but showed the typical signs of multiple sclerosis on MRI imaging of the brain. And in this small study, 44 patients were put on dimethyl fumarate and 43 on placebo, and they were followed for 96 months. Now, the hazard ratio for a first clinical MS event was reduced by almost 20%. There was also a decrease in the number of new demyelinating lesions in the brain. Logically, dimethyl fumarate had more adverse events, and now we need, similar to isolated clinical symptom, more studies. My next study is in Parkinson's disease, published in JAMA Neurology. Preclinical model in Parkinson mice showed that simvastatin obviously has a disease-modulating effect in this preclinical model, and therefore a randomized study was done in 235 patients with early Parkinson's disease. They were treated for 24 months with simvastatin or placebo, and there was unfortunately no benefit. And my last study, published in New England Journal of Medicine, deals with the observation of an increased iron content in the substantia nigra in people with Parkinson's disease. This study investigated deferriprone, which is a chelation binder, in 372 patients with newly diagnosed Parkinson's disease and no need for L-DOPA. And unfortunately, the active treatment was clearly inferior to placebo. And this indicates that iron in the brain obviously is a biomarker of Parkinson's disease, but not the cause of Parkinson's disease. Dear colleagues, 7 interesting studies in December 2022. Hopefully you will watch my videos also in 2023. I'm Christoph Diener from the University of Duisburg-Essen in Germany. Thank you very much for watching and listening.